children had almost exactly the same level of type 1 diabetes than Finnish children. And when I don't know about you, but I've talked with my mom and my dad, and I used to ask them, "Hoya abo, Somalia markaa joogteen, ilma yar sokor qaba ma arki jirteen?" And they used to be like, "No, we've never seen anything like that." And now we see that the Somali children have as much type 1 diabetes as the Finnish children, or the native Finnish children. They also looked at vitamin D level. Do you know what they found out? Well, I think I hear laughter, so I know you know. So Somali children had very low levels of vitamin D, even lower than the native Finns. What they also did in this study that I really liked is that they looked at the child who had the diabetes, who didn't have diabetes, and they both had low levels of vitamin D. I know it's a Nordic conference, but I really like this study. It's from the UK, so I chose it. Of course, there are some mental health studies done in the Nordic countries as well, but this is what I chose. Oh, sorry, to go back to the sort of why did I switch from diabetes to mental health? Because we know that the environmental factors are associated with type 1 diabetes, so we have to think of how can we make our environment healthier for us, right? So, mental health. According to the WHO, mental health should be seen as a valued source of well-being in the society, and I think we can all understand if you're not mentally healthy, you're not healthy, and you're not productive, and you're not. It's very difficult for you to contribute to the society. So, in the UK, the researchers looked at how Somalis living in the UK view mental health. So, Somalia, they asked them, what do you think of mental health? Like, how do you understand mental health? And what was the result is that instead of thinking of mental health as a psychological thing, the Somali, and I think they were a bit older. They were people who had not second generation, they were first generation who came from Somalia. So the results showed that they understood mental health as something somatic. Like when you ask them, what is mental health? They said, oh, mada hanun. It's headache. Like they would understand it as something physical because, of course, mental health is something that you cannot see, right? So since mental health is stigmatized, and also one thing that they mentioned is that, well, in the Somali community, if you have mental illness, you're labeled as crazy. That's it. So if mental health is stigmatized, and also there's this one big thing that in the Somali language, we don't have the words to describe the things, right? What's schizophrenia in Somali? What's bipolar disorder in Somali? How can you talk about something that you don't have the words for? How can you ask for help if you don't know how to describe it, right? So I also wanted to look at the access to care because it's stigmatized, we don't have the words, so how do we seek help? So there was a Finnish study by Dr. Mulki Mölsä and her colleagues, and they examined the use of healthcare services and the preference for mental health care among older Somali immigrants. This study showed that Somali elderly had significantly lower access to doctors. So even if we need the doctor, we necessarily don't go there, or we don't get to go there. You call the doctor, you're transferred to the nurse. So it's sort of the problem is both ways. We don't get the doctors because we don't ask for them, or when we ask for them, we don't get it. So it's also a healthcare system type of problem. And another thing that the study showed is that Somalis prefer to visit a normal general doctor instead of a psychiatrist or a psychologist because I need a normal doctor, right? So these findings highlight the urgent need for culturally sensitive healthcare approaches that address both the barriers and the stigma-related challenges among Somalis. So we have, I don't know if I've used the 20 minutes, but we have reached the end of my presentation. If I would to sum up my speech, I think we can all agree that there is a huge need for health promotion within the Somali community. There's a lot of information in the community as well, but we also need to sort of learn from each other. There is a need for more Somali professionals, and I think in every field, because there's so much cultural knowledge, there's so many sort of silent truths that we all know, because Somalia tahay, nobody ever told you, you didn't read it from the book, but you know it. So we have a lot of sort of knowledge that we were born with. That's why we need so many professionals in all aspects of life. I once again want to highlight that only healthy communities can be productive. And I hope that you agree with me after this presentation. Before my final point, well, at least I think I have 2 points. First point is, please eat your vitamin D. Second point is, I'm going to throw the ball at you. I want all of you to think, what do you think the Somali community needs to be healthy, physically, emotionally, and socially? Thank you.